darkness falls, truth emerges. Political cow unveils the lies. Behind the screen, wisdom surges, lighting up hate with her eyes. In the shadows, secrets lurk. She exposes, she ignites. With every post, she does the work, unmasking darkness, revealing lights. Political cow, the beacon bright, unveiling truth, banishing night. Her every post, she does the work, unmasking darkness, revealing lights. Oh, what? Political cow, the beacon bright, unveiling truth, banishing night. Her voice cuts through, stark and raw, shattering deception, breaking the law. Icons crumble, empires fall. She stands tall, fierce and cold. Her voice echoes a thunderous call. In the chaos, her strength unfolds. False prophets scatter, truth ascends. The world watches, mesmerized. Political cow's battle never ends. In her light, dark meets its demise. Political cow, the beacon bright, unveiling truth, banishing night. At every post, she does the work, unmasking darkness, revealing lights. Political cow, the beacon bright, unveiling truth, banishing night. Her voice cuts through, stark and raw, shattering deception, breaking the law. Political cow, political cow. Political cow, political cow. The beacon bright, unveiling truth, banishing night. Her voice cuts through, stark and raw, shattering deception, breaking the law. Breaking the law, breaking the law, breaking the law. Political cow. Icons crumble, empires fall. She stands tall, fierce and cold. Her voice echoes a thunderous call. In the chaos, the strength unfolds. False prophets scatter, truth ascends. The world watches, mesmerized. Political cow's battle never ends. And in her light, dark meets its demise. False prophets scatter, truth ascends. Truth ascends. The world watches, mesmerized. Political cow's battle never ends. In her light, dark meets its demise.
Well. Finally. And I mean like finally. This took my hardware and my streaming setup. We'll get that sorted with time. Just a few roadblocks in front of me. A few reboots. Had to reconfigure a few things. And all I'm trying to do is stream like from my system to two places at once, which should not be insurmountable, but it's just not working. My goodness. So for folks that are on TikTok, the folks that are on YouTube, and so forth, I appreciate you guys kind of hanging in there. I mean, it was like 4 or 5 times now, up and down. Ridiculous. So give it a like, share the live, subscribe, follow, depending on what platform you're on. I appreciate it. Almost at 17,000, which basically means we're almost at 100,000 subscribers. I mean, I don't even know what to say about that. We get to 100,000. That'd be just absolutely ridiculous. But for today, I attempted to stream off of my phone the RFK hearing That posed some issues to some of the apps that I downloaded. So a lot of things to learn in the streaming space. I know it says I'm on episode 42 here, but in all honesty, what does that constitute for me? I've been really at it here for like a couple months, 3 months now. I don't know, but a lot more to learn. We'll get this thing down. Anyway, just some takeaways. Watching what happened with RFK did not go as well as planned. Was not prepared. Was he not prepared on par with some of the stuff that we've seen from Kamala Harris? Maybe in some instances, because there were some questions that were blatantly obvious they were going to be asked of him, and he did not have. Maybe he did have a prepared response, but he didn't deliver it correctly. And that's the part that it's not just knowing the content, it's the delivery that has to be practiced, because everything here, he got pounced on. Elizabeth Warren and others, they felt like they had gotcha moments, but on top of that, they had sound bites. And their sound bites are not just echoing within, their liberal base. It's extending beyond that into other pockets. Other people are seeing this content, and it's making them scratch their heads about this, and then it's a reflection on the administration at that point in time. So it was not smooth sailing. There will be another session. A lot of the other appointees only had one meeting. Some of them were very abbreviated in terms of the time that it took to actually run through the confirmation hearing. But we'll take a look at that. I'm only going to focus in on the fireworks, the question and answer sessions that are with Democrat representatives. Some Republicans, they had questions they wanted to ask, but honestly, it seemed like they were holding back, just given the state of how things were unfolding. They didn't want to add any more fuel to the fire as to how things were unfolding. I got my old school setup right now. If you go to politicalcow.com, I've got my stream notes. All the content that we're going to look at is there right now. It says 15% off for Ground News, but if you actually use our community link, which is in the description, in my link tree, you'll find it on the website as well. It's 40% off right now. So take advantage of that. Use data and AI to really understand where your news is coming from. Not just like, oh, it's coming from CNN. Not like that, but what's the level of bias? What are they saying about a given topic? What are the talking points the left is bringing forward? What's the talking points the right or the center? Being able to get like a holistic picture of things. So the summaries that they provide are outstanding from Ground News. It helps me a lot with a lot of the research I do. And honestly, I like this stuff. It's fun. So it cuts to the chase for me very nicely. So it's 40% off right now. Take advantage of that. Links are out there, guys. But without further ado, again, this is politicalcow.com. Just my stream notes that I've published out here for everybody. We're not doing a horizontal stream because that's what got me into trouble here. Everything just came to a standstill. But I want to take a look at RFK, his nomination, and the hearing, and how things kind of unfolded for him here. All the videos, again, you check this out, all the videos, everything is just linked right in here on this page. So let's watch it as it kind of unfolds here. Get this music calm down a little bit. Roaring kitty style applause. I don't know what's going on there, but anyway. Hey guys, if you're on YouTube, like and subscribe. Pretty darn close to 17,000 right now. So he's entering the room. A lot of fanfare, as has been the case with others that have come in. Of course, Pete Hegseth was a different scenario. But a lot of people, given that he was third-party candidate, giving him a round of applause here. Don't let that fool you, because there are protesters amongst this audience. Which once they reveal themselves, you'll be like, why were they even let in? It's pretty clear this person wants to disrupt. zip through some of this a little bit. He's going. Going around shaking hands. Members of Congress, Senate. Trying to make a point that he is the unifying candidate here. Alright, let's let the chairman kick us off here. Just some opening remarks.
Good morning. This hearing will come to order. I thank my colleagues and Mr. Kennedy for being here today. Mr. Kennedy, congratulations on your nomination.
Hey, just a moment, guys. The audio's coming in a little light. Let me see
Mr.
if I can
Kennedy,
adjust
you
that.
have been accessible to members and
Just pause it right here. One sec, guys. As I try and fix that up. Bump that up a couple steps. Get back over here. All right, let's see how this goes.
staff on both sides of the aisle and have demonstrated strong commitment to fulfilling the responsibilities of this role. The Department of Health and Human Services oversees our nation's largest healthcare programs, providing coverage for nearly 2 in every 5 Americans. Improving Medicare, Medicaid, and CHIP, among other initiatives, presents challenges, especially in the face of a rapidly aging population, stubbornly high costs, and persistent barriers to access. However, this also provides us an opportunity to deliver bold, transformative solutions. As a committee, we share a commitment to advancing common sense, bipartisan policies that improve the delivery of health care in this country. This committee has worked to realign incentives in the prescription drug supply chain, to enhance access in rural communities, to expand the availability of telehealth and improve the broken clinician payment structure. Across these and other issues, I look forward to working with the administration to continue pursuing meaningful reforms that serve the American people more effectively and more efficiently. Too often, patients encounter a healthcare system that is disjointed and is a dysfunctional maze. Complex and bureaucratic chutes and ladders have become the norm. Meanwhile, even as healthcare spending climbs, outcomes across a range of conditions continue to be committed to improving the health and well-being of our nation. Regardless
of the American people, even if cannot afford to import this experiment. To know if Mr. Kennedy will abuse his power as our country's chief health, actually no knowledge or experience in handling these issues. There's one word to describe him from Portland, Oregon, who is here to represent Nurses for America, and I'd like to enter a statement from her organization into the record at this time. Thank you, Mr. Chairman.
Without objection. And nephew of President John F. Kennedy, Robert Kennedy Jr. has been an advocate for consumers since 1985. After graduating from Harvard University, Mr. Kennedy studied at the London School of Economics and received his law degree from the University of Virginia Law School and a master's degree in environmental law from Pace University. He has founded 2 advocacy groups and has spent the last 40 years working to restore and protect children's health. He was a former independent candidate in the 2024 presidential election, and President Trump nominated him this year to be in November of 2024 to be the HHS secretary. In announcing his nomination, President Trump stated, "Mr. Kennedy will restore these agencies to the traditions of gold standard scientific research and beacons of transparency and end the chronic disease epidemic and make America great and healthy again." Before you give your opening statement, Mr. Kennedy, I have 4 obligatory questions that we ask all nominees before this committee. First, is there anything that you are aware of in your background that might present a conflict of interest with the duties of the office to which you have
here today and all the many members of Strength Addicted today and all too.
We welcome you all. Thank you. You may proceed with your statement.
Thank you, Mr. Chairman. Chairman Crapo, Ranking Member Wyden, and members of this distinguished committee. I'm humbled to be sitting here today as President Trump's nominee to oversee the U.S. Department of Health and Human Services. I want to thank President Trump for entrusting me to deliver on his promise to make America healthy again. I also want to thank Cheryl and Kik and Bobby and all of my other children who are here today and all the many members of my large extended family for the love that they have so generously shared. Ours has always been a family that has been involved in public service, and I look forward to continuing that tradition. My journey into the issue of health began with my career as an environmental attorney, working with hunters and fishermen and mothers in a small town in the Hudson Valley and along the Hudson River. I learned very early on that human health and environmental injuries are intertwined. The same chemicals that kill fish make people sick also. Today, Americans' overall health is in grievous condition. Over 70% of adults and a third of children are overweight or obese. Diabetes is 10 times more prevalent than it was during the 1960s. Cancer among young people is rising by 1 or 2% a year. Autoimmune diseases, neurodevelopmental disorders, Alzheimer's, asthma, ADHD, depression, addiction, and a host of other physical and mental health conditions are all on the rise, some of them exponentially. The United States has worse health than any other developed nation, yet we spend more on health care, at least double, and in some cases triple, as other countries. Last year, we spent $4.8 trillion, not counting the indirect costs of missed work. That's almost a fifth of GDP. It's tantamount to a 20% tax on the entire economy. No wonder America has trouble competing with countries that pay a third of what we do for health and have better outcomes and a healthier workforce. But I don't want to make this too much about money. It's the human tragedy that moves us to care. President Trump has promised to restore America's global strength and to restore the American dream, but he understands we can't be a strong nation when our people are so sick. A healthy person has 1,000 dreams. A sick person has only one. Today, over half of our countrymen and women are chronically ill. When I met with President Trump last summer, I discovered that he has more than just concern for this tragic situation, but genuine care. President Trump is committed to restoring the American dream, and 77 million Americans delivered a mandate to him to do just that, due in part to the embrace and elevation of the Make America Healthy Again movement. This movement, led largely by Maha moms from every state, you can see many of them behind us today, and in the hallways and in the lobbies, is one of the most transcendent and powerful movements I've ever seen. I promise President Trump that if confirmed, I will do everything in my power to put the health of Americans back on track. And I've been greatly heartened to discover a deep level of care among members of this committee, too, both Democrats and Republicans. I came away from our conversations confident that we can put aside our divisions for the sake of a healthier America. For a long time, the nation has been locked in a divisive healthcare debate about who pays. Well, when healthcare costs reach 20%, there are no good options, only bad ones. Shifting the burden around between government and corporations and insurers and providers and families is like rearranging deck chairs on the Titanic. Our country will sink beneath a sea of desperation and debt if we don't change the course and ask, why are healthcare costs so high in the first place? The obvious answer is chronic disease. The CDC says 90% of healthcare spending goes toward managing chronic disease, which hits lower income Americans the hardest. The president's pledge is not to make some Americans healthy again, but to make all of our people healthy again. There is no single culprit in chronic disease. Much as I have criticized certain industries and agencies, President Trump and I understand that most of their scientists and experts genuinely care about American health. Therefore, we will bring together all stakeholders in pursuit of this unifying goal. Before I conclude, I want to make sure the committee is clear about a few things. News reports have claimed that I'm anti-vaccine or anti-industry. I am neither. I am pro-safety.
We'll have order. Please proceed, Mr. Kennedy.
Yeah, didn't really get a good look at that protester. I was hoping to see him. As with a lot of these nominations, there's just been protesters that keep creeping up on him. So didn't really get a good look at that one. Hopefully we get another good one here.
I am pro-safety. I worked for years to raise awareness about the mercury and toxic chemicals in fish, and nobody called me anti-fish. And I believe that that vaccines play a critical role in healthcare. All of my kids are vaccinated. I've written many books on vaccines. My first book in 2014, the first line of it is, I am not anti-vaccine, and the last line is, I am not anti-vaccine. Nor am I the enemy of food producers. American farms are the bedrock of our culture, of our politics, of our national security. I was a 4-H kid, and I spent my summer working on ranches. I went to work with our farmers. I want to work with our farmers and food producers to remove burdensome regulations and unleash American ingenuity. MAHA simply cannot succeed without a partnership, a full partnership of American farmers. In my advocacy, I've often disturbed the status quo by asking uncomfortable questions. Well, I'm not going to apologize for that. We have massive health problems in this country that we must face honestly. And the first thing I've done every morning for the past 20 years is to get on my knees and pray to God that he would put me in a position to end the chronic disease epidemic and to help America's children. That's why I'm so grateful to President Trump for the opportunity to sit before you today and seek your support and partnership in this endeavor. I will conclude with a promise. The members of this committee, to the president, and to all the tens of millions of parents across America, especially the moms, who have propelled this issue to center stage. Should I be so privileged as to be confirmed, we will make sure our tax dollars support healthy foods. We will scrutinize the chemical additives in our food supply. We will remove financial conflicts of interest from our agencies. We will create an honest, unbiased, gold standard science at HHS, accountable to the president, to Congress, and to the American people. We will reverse the chronic disease epidemic and put the nation back on the road to good health. Thank you.
Thank you, Mr. Kennedy. Mr. Kennedy, I will begin. Each of us will have 5 minutes to ask you questions, and then at the conclusion of the hearing, if there are further questions, there will be an opportunity for those questions to be submitted to you, and I ask that you respond to them promptly. Mr. Kennedy, you have emphasized the importance of nutrition in preventing and managing chronic disease, improving health outcomes, and reducing health costs. I share your interest in the relationship between our diet and our well-being. And if confirmed, I look forward to partnering with you on those efforts. Would you share with the committee why?
All right, so opening remarks. I mean, one of the things that's difficult, he has difficulty speaking with what's been impacted, whatever has impacted his vocal cords. So the information he conveys doesn't come off quite right. The opening remarks didn't feel like there was anything significant of it. But we're starting off here with a Republican. I am going to just zip forward a little bit because there we go. Let's go to the ranking member on the Democrat side. See what he kind of brings up.
For anti-vaccine. But during a podcast interview in July of 2023, you said, quote, "No vaccine is safe and effective." In your testimony today, in order to prove you're not anti-vax, you note that all your kids are vaccinated. But in a podcast in 2020, you said, and I quote, "You would do anything, pay anything to go back in time and not vaccinate your kids." Mr. Kennedy, all of these things cannot be true. So, are you lying to Congress today when you say you are pro-vaccine? Or did you lie on all those podcasts? We have all of this on tape, by the way.
Yeah, Senator, as you know, because it's been repeatedly debunked, that statement that I made on the Lex Friedman podcast was a fragment of the statement. He asked me, and anybody who actually goes and looks at that podcast and will see this. He asked me, are there vaccines that are safe and effective? And I said to him, some of the live virus vaccines are. And I said, there are no vaccines that are safe and effective. And I was going to continue for every person. Every medicine has people who are sensitive to them, including vaccines.
Right, so
he interrupted me at that point. I've corrected it many times, including on national TV. You know about this, Senator Wyden, so bringing this up right now is dishonest.
let's be clear about what you've actually done then, since you want to deny your statements. For example, you have a history of trying to take vaccines away from people. In May of 2021, you petitioned the Food and Drug Administration to not only block Americans from having access to the COVID vaccine, but to prevent any future access.
Man, this senator's lisp is getting to me. I apologize. I know we're not trying to get on people's voices and stuff here, but that lisp is just getting to me. I can't even concentrate. Waiting for him to pull out a Suffer Succotash or something like he was one of those Looney Tune characters back in the day.
Access to the life-saving vaccine. Are you denying that? Your name is on the petition.
We brought that petition after CDC.
We got to hear that again. Your name was on the petition. What was that? Who talks like that? Let's rewind it here 10 seconds.
He recommended
Vaccine. Are you denying that? Your name is on the petition.
we brought that petition after.
How contrived was that emotion? I mean, honestly, he's just devoid of any real feeling, any real passion behind what they're saying. All of it written down. You see the staffer coming in, throwing more stuff at them as they figure things out and want their talking head to follow suit. So it just begs the question, who's really in charge of any of these given positions, in these political appointee positions, right? You want somebody that's strong, somebody that demonstrates integrity and has some leadership capability to them. But nevertheless, there's always examples of, like this.
CDC recommended
like and subscribe, folks.
the
Like and
COVID
subscribe.
vaccine without any scientific basis for 6-year-old children. Most experts agree today, even the people who did it back then, that COVID vaccines are inappropriate for 6-year-old children who basically have a zero risk from COVID. That's why I brought that lawsuit. I don't want to. I want to emphasize
Mr. Kennedy, the facts.
I don't.
The facts.
Uh-oh.
The committee will be in order. And to the audience.
Hold on for a second, Mr. Kennedy. To the audience. Comments from the audience are inappropriate and out of order. And if there are any further disruptions, the committee will recess until the police can restore order. Please follow the rules of the committee. Mr. Kennedy, you may proceed.
I also want to point out that your recitation of what happened in Samoa is absolutely wrong, and you know it's wrong, and you know it's wrong.
We'll get to that in a moment. Right now, we're talking about the petition that you filed to block Americans from having access to the vaccine and to prevent any future access to the vaccine. Those facts are on the record. My third question to you is, you made almost $5 million from book deals, mostly promoting junk science. In 2021, in a book called The Measles Book, you wrote that parents had been, quote, misled into believing that measles is a deadly disease and that measles vaccines are necessary, safe, and effective. The reality is measles are in fact deadly and highly contagious, something that you should have learned after your lies contributed to the deaths of 83 people, most of them children, in a measles outbreak in Samoa. So my question here is, Mr. Kennedy, is measles deadly, yes or no?
The death rate from measles historically in this country in 1963, the year before the introduction of the vaccine, was 1 in 10,000. Let me explain what happened in Samoa. In Samoa in 2017 or 2015, there were 2 kids who died following the MMR vaccine. And the vaccination rates in Samoa dropped precipitously from about 63% to the mid-30s, so they've never been very high. And in 2018, 2 more kids died following the MMR vaccine, and the government of Samoa banned the MMR vaccine. I arrived a year later when vaccination rates were already below any previous level. I went there, nothing to do with vaccines. I went there to introduce a medical informatics system that would digitalize records in Samoa and make health delivery much more efficient. I never gave any public statement about vaccines. You cannot find a single Samoan who will say, I didn't get a vaccine because of Bobby Kennedy. I went in June of 2019. The measles outbreak started in August. Oh, clearly I had nothing to do with the measles. Not only that,
Mr. Kennedy,
Senator, not only that, if you let me finish, Senator.
You have had some time.
If you let me finish, Senator, if you let me finish, there are 83 people died. When the tissue samples were sent to New Zealand, most of those people did not have measles. We don't know what was killing them. The same outbreak occurred in Tonga and Fiji, and no extra people died. There were 7 measles outbreaks in the 13 years prior to my arrival.
I just would like to get my time back. The nominee wrote a book saying that people had been misled into believing that measles is a deadly disease. He's trying now to play down his role in Samoa. That's not what the parents say. That's not what Governor Green says. It's time to make sure that we blow the whistle on actually what your views are. At least we're starting.
We need to move on.
I support the measles vaccine. I support the polio vaccine. I will do nothing as HHS secretary that makes it difficult or discourages people from taking either of those
Anybody
vaccines.
who believes that ought to look at the measles book you wrote saying parents have been misled into believing that measles is a deadly disease. That's not true.
We need to move on. Senator Grassley.
Welcome. I'm going to do like I did in my office. I'm just going to make some points to you. I got about 7 I want to quickly get done. And then at the end, I'm going to ask if you disagree with anything I say and then address those things you disagree with. I'll make sure I save time for you to do that. A key responsibility of each member of Congress is oversight. Oversight allows us to hold bureaucrats accountable to the rule of law, and it helps keep faith with taxpayers. I expect HHS to provide timely and complete responses to congressional oversight. Number 2, PBMs, something you and I discussed in our office. I've been working to hold pharmacy benefit managers accountable in order to lower prescription drug prices. I expect you to work with us to hold PBMs accountable, and that may even asking your support for legislation that's before the Congress. Drug pricing. Senator Durbin and I have for a while been trying to get a bill passed that requires price disclosures on TV ads for prescription drugs. Knowing what something costs before buying it is just common sense. President Trump tried to do this by regulation in his first term. Vice President Vance co-sponsored our bill last Congress. I ask you to support this bill, or if you can do it by regulation, to do it by regulation. On rural health care, the previous administration dragged its feet in opening up slots for.
All right, we're going to zip along because the Republicans seem to make a little bit more of a monologue. It's not really a back and forth. You saw the ranking member on the Democrat side lisping all, really kind of went all in, tried to call him out and make him run away scared. So he's not gonna go for the nomination. Good luck with that. But let's see if we can get another Democrat up here. Hang on a sec, guys. Let's try to zip through here. Senor Grassley. Okay, here we go. Got another person. Let's go.
Under the previous administration, as Senator Grassley alluded, there were
fine.
roughly 500,000
childhood slavery.
for our time.
To fulfill. So disturbing to their point. Peddling, my friend from Texas, as a school superintendent, to fulfill a really important responsibility, which is to decide whether to confirm Mr. Kennedy to one of the most important health care jobs in America. And the reason I think it's so important is for many
Give
of
the
the
live a
reasons you
like,
said in
folks.
your
I'd
opening
really
statement,
appreciate it.
which is that we live in the richest country in the world, and we have some of the worst health outcomes of any industrialized country in the world.
I will be right back.
We live in the richest country in the world, and we have some of the lowest life expectancy rates of anybody in the industrialized world. I was a school superintendent before I was in this job, Mr. Chairman, and I can tell you that Mr. Kennedy's right, that when I look at the kids in the Denver public schools, if we don't change the way we eat in this country, 40% of them are going to suffer adult diabetes as a result of their diet. And we're, as I said, spending more than any other country in the world, and our families, every single person's constituents in this Senate are facing chronic shortages when it comes to health care. My friend from Texas, Senator Cornyn, has been a champion on mental health care. We have an epidemic, as he knows, across this country in mental health care, partly because of what the massive social media platforms that were sitting behind the President of the United States have inflicted on our children for their profit in the last decade or so. So we have no shortage of challenges to confront, and I even agree with some of the diagnosis of Mr. Kennedy. What is so disturbing to me is that out of 330 million Americans, we're being asked to put somebody in this job who has spent 50 years of his life not honoring the tradition that he talked about at the beginning of this conversation, but peddling in half-truths, peddling in false statements, peddling in theories that, create doubt about whether or not things that we know are safe are unsafe. Not that every vaccine in America is unsafe, not that you can't possibly have an adverse reaction, but that parents and children in my old school district and school districts all over this country would be better off not getting vaccinated than getting vaccinated. Unlike his own children who were vaccinated, unlike the people he invited to his house in Los Angeles for their party who were vaccinated. For everybody else, it's about peddling these half-truths. And he says it with such conviction that you want to believe him. And Mr. Kennedy, I just have there are many, many things in the record, but I hope that you could answer these questions yes or no. I've tried to ask these in a manner that's faithful to what you actually said, because I didn't want to have a debate about whether you actually said them. So I'm asking you yes or no, Mr. Kennedy. Did you say that COVID-19 was a genetically engineered bioweapon that targets black and white people, but spared Ashkenazi Jews and Chinese people?
I didn't say it was deliberately targeted. I just quoted an NIH-funded and NIH published study.
Did you say that it targets black and white people but spared Ashkenazi Jews?
I
and
quoted a
Chinese?
study, Your
Okay.
Honor. I quoted
So
an NIH study that showed that
I'll take that as a
certain
yes.
races
I have
are
to move on,
disproportionately-
I have to move on. Did you say that Lyme disease is highly likely a materially engineered bioweapon? I made sure I put in the highly likely. Did you say Lyme disease is a highly likely militarily engineered bioweapon?
I probably did say that.
Did you say that?
And that's what the developer of
I
Lyme
want all
disease
of our
said.
colleagues to hear it, Mr. Kennedy. I want them to hear it. You said yes. Did you say that exposure to pesticides causes children to become transgender?
No, I never said that.
Okay, I have the record that I'll give to the chairman, and he can make his judgment about what you said. Did you write in your book, and it's undeniable, that African AIDS is an entirely different disease from Western AIDS? Yes or no, Mr. Kennedy?
I'm not sure if I made that.
Okay, I'll give it to the chairman, Mr. Kennedy. And my final question, did you say on a podcast, and I quote, "I wouldn't leave abortion, to the states. My belief is we should leave it to the woman. We shouldn't have the government involved, even if it's full term." Did you say that, Mr. Kennedy?
Senator, I believe that every abortion is a tragedy.
Did you say it, Mr. Kennedy? This
believe-
matters. It doesn't matter what you come here and say that isn't true, that's not reflective of what you really believe, that you haven't said over decade after decade after decade, because unlike other jobs we're confirming around this place, this is a job where it is life and death for the kids that I used to work for in the Denver public schools and for families all over this country that are suffering from living in the richest country of the world that can't deliver basic health care and basic mental health care to them. It's too important for the games that you're playing, Mr. Kennedy. And I hope my colleagues will say to the president, I have no influence over him. I hope my colleagues will say to the president, out of 330 million Americans, we can do better than this.
Thank you. We need to move on. Senator Cassidy.
Mr. Kennedy, President Trump has sworn to protect Medicare. Republicans are exploring reforms to Medicaid that could help pay for Trump administration priorities. With this context, what will you do about dual eligibles?
About,
Dual eligibles.
well, dual eligibles are not right now served very well under the system. Those are people who are eligible for both Medicaid and Medicare. I suppose my answer to that is to make sure that the programs are consolidated, that they're integrated, and the care is integrated. I look forward to working with you, Dr. Cassidy, on making sure that we take good care of people who are
Thank you.
dual eligible.
And how do you propose that we integrate those programs? Does Medicare pay more, Medicare pay less, Medicaid pay more, Medicaid pay less? How do we do that?
So the last senator that went, the Democrat, threw a lot at him, really kind of called him out on things. Oddly enough, you think he would have been excited about his position on abortion, but he tried to call him out as hypocritical. I think that would have been a good thing on his side of things, but I don't know. What do I know? Interestingly, excuse me, enough now, we got Senator Cassidy here, a Republican, that's, asking some serious questions that he does have, but Kennedy, just in my view, how he's answering them seems to be a little frazzled from that last exchange. Is not doing a good job talking through this. And this is about people who qualify for both Medicare and Medicaid, how those are handled, and what are some best practices or some strategies or approaches that you have in place. And, all these types of questions, when you get into super level of detail like that, to me, I don't think that they hold a lot of weight, because it's like, well, doggone it. I mean, let's get the team together and talk through it and come up with an answer, because being a leader at that level, you're not the answer guy. You bring the right people together to drive the right outcomes and results and hold people accountable. It's not you that is the bearer of all ideas. But of course, that's what the media likes to portray, and that's an easy thing to try to do the gotcha politics with. I was just surprised that Cassidy was putting stuff out there like that, but it was a little bit more of a lightweight exchange. So I'll play a little bit more of it, and then we're going to skip to another Democrat.
Well, I'm not exactly sure because I'm not in there. I mean, it is difficult to integrate them because Medicare is under fee-for-service. It's paid for by employer taxes. Medicaid is fully paid for by the federal government, and it's not fee-for-service. So I do not know the answer to that. I look forward to exploring options with you.
Republicans, again, are looking at ways to potentially.
That's an unfortunate thing of his speech impediment. I don't know if that's the proper terming. It just makes it seem like there's a level of uncertainty with which he responds to anything, and there may not be. He has a little bit of an impaired speech pattern or whatever it's called. So it just gives the wrong impression. So what's Rachel Maddow going to do? What are all these other folks going to do? I mean, they're going to take advantage of it. They're going to lay in on it. Very unfortunate, right?
To reform Medicaid to help, pay for President Trump's priorities, but to improve outcomes. What thoughts do you have regarding Medicaid reform?
Well, Medicaid is not working for Americans, and it's specifically not working for the target population. Most Americans, like myself, I'm on Medicare Advantage, and I'm very happy with it. Most people who are on Medicaid are not happy. The premiums are too high. The deductibles are too high. The networks are narrow. The best doctors will not accept it in the best hospitals. And particularly, Medicaid was originally designed for a target population of the poorest Americans. It's now been dramatically expanded. And the irony of the expansion is that the poorest Americans are now being robbed. Their services have dramatically decreased, even though we've increased the price of Medicare by 60% over the last 4 years. The target population is being robbed.
With that
figure
said,
out other options.
Obviously, you've thought about that, and I appreciate that. What reforms do you recommend, again, that would improve services, I suppose, but also make it?
This is exactly the thing. Like, what reforms do you recommend? It's like, come on, man. Like, how is he supposed to know about everything HHS to be able to properly recommend these types of reforms? I know he's been busy and getting at it since the election, but still, I think that's a tall order to ask for somebody to have those things defined up front.
More cost efficient.
So let's head on over to
President
a
Trump
friendly Democrat.
has given meetings with now.
Vote. I voted for President. Somebody's out there solutions, guidance, and announcement that was to be the basis. Well, I got to tell you,
It will be on private insurance.
well, I got to tell you, for literally hundreds of thousands of Virginians, Medicaid is what prevents them from health crises on a daily and weekly basis. And some imaginary new plan, and if there was a new plan that was to be the basis of what Trump was going to do when repealing Obamacare, I would have thought by now we'd have seen it. I got to tell you, listen,
Senator, can I reply to that?
Senator, Mr. Kennedy, I got questions. I appreciate our visit. I know you take your views seriously, and I don't reflexively vote. I voted for 4 of President Trump's nominees already. Got a lot of grief from folks on this panel. But I got to tell you, I saw an email that you put out Monday night, or your campaign did, in a fundraising email. Your presidential campaign celebrated that the freeze on all new regulations, guidance, and announcements is a way to protect unelected bureaucrats from further undermining our health freedom. Then you ask your donors to help pay for your campaign debt. Did your campaign and you put out that?
I don't think my campaign exists anymore.
All right, well, listen, I got to tell you this. Somebody's out there soliciting money for it. Maybe you ought to find out who is. So the fact that you celebrate this freeze, do you think that was a good idea to put all of this on hold for 90 days, funding and any kind of further work, NIH research?
As Chairman Crapo pointed out.
I'm not asking for, I love Mike Crapo. I'm asking you. You're up for a very important position.
As he pointed out, Senator, the portals that were closed were not closed as a result of the Trump
Let me just tell you. I'd like you to explain, excuse me, sir.
Not
I'd like you to
closed.
explain to a domestic violence center in Richmond that's saying because this freeze, they may have to close down, where those battered women to go. Or a rural nonprofit I've got in the Shenandoah Valley who's saying that freeze is going to potentially shut down their ability to operate.
I tell you what, Mark Warner, like, I mean, last person I would want to get stuck in an elevator with, last person I would want to have a beer with. I mean, it'd be really like, you got to be kidding me. Who voted for this guy? That's where we need to start with things.
So I guess if you deny or don't know what your campaign's sending on, you don't know if you raised a lot of money Monday night.
I'm saying that the Trump administration
You don't know if you raised a lot of money.
The Trump administration has made clear that it
Did he just say you don't know you raised a lot of money? Let me go back 10 seconds here.
does not want
A lot of money Monday night.
I'm saying that the Trump administration
You don't know if you raised a lot of money.
The Trump administration has made clear that it does not want to freeze benefits for any Americans under Medicaid or Medicare, and I do not want to dismantle Medicaid.
The freeze is affecting beyond Medicare and Social Security. I would hope you would have known that to be able to answer some of this. Now, you've said publicly you want to immediately get rid of 600 NIH workers on job one, on day one. When we had our meeting, you said you'd actually like to get rid of 2,200 people from HHS. Which offices are you going to start cutting and riffing these 2,200 workers from?
Senator, there's 200 political appointees that are changed during every administration.
So if you got rid of those 200 political appointees, you're not going to replace them with your political appointees?
Well, President Biden this year changed 3,000 employees at HHS. 3,750 at NIH.
You're 2,200. What departments are you going to pick them from?
Well, the same as President Biden did when he changed 3,000 out.
I'm down to a minute 30. The chairman's been generous with colleagues on both sides and may have to go a couple minutes over. But let me just say, so let's just answer. This would be, I hope, since you're asking.
Yeah, Warner's like helping him out here. So the first one, the ranking member, I can't remember the senator's name now. He really kind of got things off on the right foot for the Democrats, and it was like, oh, where's this going? Warner, I mean, come on, man. You just kind of handed everything back to him now. And I mean, I'm looking at this purely from a strategic standpoint, observing how this will be kind of taken in. What will Rachel Maddow say, right? So probably only play that clip with the ranking member. Maybe just segments of this one to take things out of context. We'll see. I'll have to look that up. What did she say?
To become the top healthcare official in the United States in terms of HHS, huge ramifications. And part of this job is to be the senior advisor to the president on health issues. So when we're looking at this purge and we're looking at laying off workers, when we're looking at potentially the president's illegal offer to try to buy out federal employees, which I would say to any federal employees, think twice. Has this individual in his business world ever fulfilled his contracts or obligations to any workers in the past? But if you are in this position, will you pledge that you will not fire federal employees who work on food safety, work on trying to preventing things like salmonella?
Senator, there are 91,000 employees.
So that I take that as that's a simple yes, and I'm going to take that as a no.
Run that agency
I take that as a no. Will you actually? We talked about protecting Americans from cyber criminals, something we need to do a lot more on. Will you commit not to fire anyone in the health arena who currently works on protecting Americans from cyber attacks in their healthcare files?
I will commit to not firing anybody who's doing their job.
I love it. That was beautiful. We'll commit to. Yeah, I mean, there's all kinds of welfares. There's corporate welfare out there, guys. I mean, I'm seeing it myself now. We got to go sort through and fix that stuff. Happens for various reasons. Got to reinvigorate people to kind of get things done, because once you fall behind as an organization, I mean, the government the same. Debt starts piling up, inefficiency starts piling up, services start getting, not so great. Companies go bankrupt, like it can't go on forever. Blockbuster decided not to buy Netflix. Can you believe that? And where are they now? There's one store left. But anyway, so Senator here, Mark Warner's, he's going nowhere with this stuff.
Based on your opinion, based upon your opinion, or your political agenda, or Mr. Trump's political agenda?
Based upon my opinion.
I guess that means a lot of the folks who've had any type of views on vaccines will be out of work. Will you freeze grant funding for community health centers? Will you freeze federal funds for community health centers, the way the current administration has done?
The White House has made clear that no funds are going to be denied to any American for benefits in any program.
Do you know what happens at community health centers? Those are direct.
Are you talking about the Indian health centers?
No, I'm talking about community health centers across the country.
I understand that. I mean, I strongly
So you're going to excuse Indian health centers, which is good, but others are not. They're going to get their funds frozen.
I strongly support community health centers, as does the president.
So does that mean you're not going to freeze the funding that is currently frozen?
The White House has made clear that none of that funding is supposed to be frozen.
Sir, the direct payments are different than how the government operates. We fund the federal government down to community health centers. As a former governor,
so these payments, right? I mean, check out my live from last night. This stuff's, yeah, absolutely. America first. What's being frozen here? So, I mean, they've found already, what was it, like $60 million that was going to go to the World Health Organization, which Trump signed on day one, an executive order that pulled us out of that. Why would a week later $60 million of federal funds go towards that? It needs to get stopped. So this is what the freeze is all about. Let's freeze, see what's about to go out the door, and kind of give it a thumbs up or a thumbs down, right? There's other ridiculousness that were going out to Gaza. I think it was like tens of millions of dollars for kind of, was it for condoms, for like sexual health? Bizarre stuff, right? Like, let's put a stop to that stuff. Like, hey, hang on a second. Is that really a priority right now? So what's being done here, though, is it's being misconstrued and turned around like, oh, you're gonna freeze essential services for people. They can't go see the doctor. They can't seek help. They've got the flu. They've got COVID. They've got whatever ailment it might be. You're disallowing those services for them, which sounds alarming to people, but that's not the case, right? Because benefits that people have or are entitled to under our current system will continue. This is just an evaluation of all those extraneous type activities to see what we can stop immediately and get some really quick wins on it.
there's lots and lots of state programs that are related to health care that come from the federal government, they come down to the state, then it goes to local programs. All of those don't directly pay out $1 at a time, but they come from federal funding. They are all, even though they keep changing the guidance on a minute-by-minute basis, based upon 9:45 or 10:30 or 10:45, whatever time it is today, those funds are still frozen. Sir, I just honestly, I want to give you a fair shot, but I don't feel like you approach this job with the knowledge and candidly your willingness not to commit, try to recommend to the president to make sure these funds are unfrozen and that people's lives are at stake is a very disappointing answer. Thank you, Mr. Chair.
So that last bit is the clip that Rachel Maddow will play. There are no frozen funds. What is he talking about? I mean, in that regard of what he describes, none of that's frozen. What are you talking about?
Chairman.
Senator Lankford.
Chairman, thank you. Mr. Kennedy, it's good to see you again. We had some great visits in my office. We've done some follow-up calls to be able to go through. You and I have talked about 100 different issues and background
zip
things.
Through this one. Let's get to another person
address
here.
a lot of them today and just different questions to be able to clear up social media rumors and the things that are out there on it. So I do appreciate that. We've talked about pharmacy.
funding for abortions.
Oklahoma is Trump
There are
country,
other
so
people who, and
No
maybe some
experience with
softballs on that.
CMS, so you're just going to have to listen. Two things. One,
Wait, what did he say?
if you want, and I've got.
Senator Whitehouse.
All right, Whitehouse.
Thank you, Chairman. Mr. Kennedy, I only have 5 minutes with you, and I've got a lot of experience with CMS, so you're just going to have to listen. Two things. One, if you want to move from advocacy to public responsibility, Americans are going to need to hear a clear and trustworthy recantation of what you have said on vaccinations, including a promise from you never to say vaccines aren't medically safe when they in fact are, and making indisputably clear that you support mandatory vaccinations against diseases where that will keep people safe. You're in that hole pretty deep. We've just had a measles case in Rhode Island, the first since 2013. And frankly, you frighten people. Two, I want to air harms that Rhode Island has experienced from a remorseless, senseless CMS bureaucracy. CMS has for years maintained a reimbursement system that the bureaucracy could never explain, never justify, that persistently pays Rhode Island providers less than neighboring Massachusetts and Connecticut providers. A differential of 23 and 26% in our regional healthcare market. The Pending Ahead program can begin to remedy this, at least for value-based care, and it must. There has to be payment parity in the region. Rhode Island's healthcare system is bleeding out because we aren't paid what neighboring hospitals and doctors are paid, and the one act CMS took on this years ago was to make it worse. The CMS bureaucracy has also attacked one of the best accountable care organizations in the country, Rhode Island's Integra Family Doctors. Tried to throw them off the shared savings program because they said Integra years ago briefly fell 137 patients short of the 5,000 patients that ACOs need. CMS wouldn't listen until a court found that to be unjustified, likely illegal, irreparable harm to this high-performing ACO and its patients, and contrary to the public interest. That must stop. Last, CMS has refused.
Anyone have any idea what he's talking about here? I mean, you dive in too technical. A lot of this showing dog and pony that they're doing is for the public. So if you're going to do that, break it down in terms that people will actually understand. He's getting really technical, whatever it is he's talking about. Seems to be really excited, but I mean, RFK is taking the right approach. I was like, I'm just going to chill. I'll let you do your rant until maybe there's a question. We're just going to wait the time out.
To approve waivers granted elsewhere for Rhode Island from rules that are stupid for Medicare patients who are nearing the end of their days. Here's what families see. Granny is home dying. She needs to transfer to a nursing home, and Medicare insists on putting her 3 days and 2 nights in a hospital. Expensive, frightening to Granny and the family, and stupid. Granny's home dying and can't get palliative and curative care together. Inhumane and stupid. Granny's home dying and can't get home care if she can still get out into the yard or be driven to see the shore, to see Narragansett Beach, say, one more time, to recall childhood memories before she dies. Inhumane and stupid. Granny's home dying and the family's exhausted And the respite care benefit is not to send a nurse or a caregiver, but to stuff Granny in an ambulance and haul her off to a hospital. Some respite. It's all expensive, frightening, inhumane, and stupid. But the insensate CMS bureaucracy takes a court order to be awakened to the harm they cause. I have had enough. CMS should let Rhode Island try humane end-of-life care through CMMI. Let's see if it works at a state. I bet it will save money, serve families better at a very, very delicate time, and perhaps even make a model for better health care everywhere. I've said a lot. My time is out. You're welcome to respond in writing. I ask unanimous consent that the order declaring CMS's actions to constitute irreparable and illegal harm be put into the record.
Without objection.
Let me just respond very briefly, Senator Whitehouse. I'm an implacable enemy of tyrannical, insensate bureaucracies and stupid rules, and I will work with you to make CMS responsive to the needs of Rhode Island and to remedy those disparities that you talk about. I am familiar with the Integra Health plan, and it is the template for what we ought to be doing is a value-based plan. And I look forward to you to making sure that we create pilot programs like this.
Unfortunately, Mr. Chairman,
around the country.
Unfortunately, Mr. Chairman, one of the things I've learned in my tenure in the Senate is that a nominee saying that they're willing to work with me amounts to exactly zero. We need to get this fixed. Thank you.
Well, I guess at that point, then, we will move on to Senator Daines.
Mr. Chairman, thank you. Mr. Kennedy, I'm glad to see you here this morning. I listened to your opening remarks, and you mentioned that you want to make HHS the gold standard of science. I have found my engagements with you, both behind closed doors in my office, as well as listening to you publicly, to be very thoughtful and science-based. I applaud that. I thank you for that. And I realize this will likely be a very partisan vote on this committee and on the Senate floor. But let the record state there are 3 medical doctors on this side of the dais. I'm a chemical engineer. We believe in science. I'm thankful that you do too, and you made that comment in your opening remarks. I want to talk about agriculture for a moment. We talked about our common love for Montana. You've been to Montana many times. It's a wonderful state. A lot of folks have discovered it. They watch the show Yellowstone, and people are coming and moving into our state, but it's an amazing place. But as you know, agriculture is our top economic driver in Montana. We produce some of the highest quality crops, the best livestock in the country and the world. Our farmers and our ranchers are truly some of the most effective environmental stewards in ensuring we have a safe food supply chain in the world. I share your view that protecting the integrity and safety of our food supply is of utmost importance. I appreciate the research happening in places like Montana State University to help farmers produce resilient, healthy, and safe crops, as well as their agricultural practices. You mentioned you were a 4-H kid growing up. I think our 4-H kids and our FFA kids are some of the best kids in America. My question for you, Mr. Kennedy, is if confirmed, as I'm listening to my farmers and ranchers talk about the future, will you commit to working collaboratively with partners at USDA, at the relevant federal agencies, as well as our Montana farmers and ranchers before implementing any policy that might affect or impact food supply?
Absolutely will make that commitment. I have, as I shared with you, a personal commitment and a long career working with farmers. I want to make sure I understand the very, very narrow margins, the slim margins that American farmers and ranchers are dealing with. And I don't want, under my watch, a single farmer to have to leave his farm for economic reasons or for regulatory or bureaucratic reasons while I serve, if I'm privileged to serve, to be confirmed as HHS Secretary. Even more important, President Trump has a very, very strong commitment to farmers. President Trump is probably historically in modern history the best farm president in our history. Farm income spiked for the first time in decades under his last administration. He got solid support from farmers across the country. Farm country is Trump country. Farmers across the country supported him during this election. He has specifically instructed me that he wants farmers involved in every policy, and that he wants me to work with Brooke Rollins at USDA to make sure that we preserve American farmers, that all of our policies support them.
Mr. Kennedy, thank you. And if confirmed, I look forward to having you and Brooke Rollins out to Montana to spend some time with
you. Have my commitment to come there anytime, particularly during ski season or hunting season.
Deal. I want to shift gears for a moment. As we discussed in the meeting we had in my office, mifepristone was approved in 2000. The FDA has been under scrutiny and brought to court for failure to properly assess this drug, as well as subsequent deregulations Senator Langford described that have occurred over the past 25 years. Some of these deregulations included ending the requirement that these drugs be prescribed by a doctor, ending reporting requirements for adverse events, and allowing these pills to be obtained through the mail. In fact, the FDA's own prescribing label mentioned that 3 to 5% of women taking this drug end up in the emergency room. My question is, if confirmed as Secretary of HHS, will you commit to working with the FDA Commissioner to review these deregulatory actions that are threatening the safety of women?
Sorry, Senator. As I said to Senator Langford, I think it's immoral to have a policy where patients are not allowed to report adverse events and where doctors are discouraged from doing that. President Trump has asked me to study the safety of mifepristone. He has not yet taken a stand on how to regulate it. Whatever he does, I will implement those policies. I will work with this committee, make those policies make sense.
Thank you, Mr. Kennedy.
Senator Hassan.
Thank you, Mr. Chair and Ranking Member Wyden, and welcome, Mr. Kennedy, and to your family as well. I want to start with a couple of concerns I have, and just briefly on Medicaid. States share in the funding of Medicaid. Millions of disabled children in this country are alive because of Medicaid. Millions of people with addiction in this country are in recovery because of the services provided to them by Medicaid. And millions of chronically ill people who, until Medicaid expansion was enacted, who couldn't get health care and therefore couldn't work because they were too sick, got health care through Medicaid expansion, then went back to work, and now they're on private insurance. So those are some facts about Medicaid that you might want to brush up on. Now, I'm also extremely concerned about your endorsement of radical fringe conspiracies that, if implemented at HHS, would put American families' lives at risk. Vaccines are one of our greatest public health triumphs. And you don't need, I'm not talking about abstract medical science. One of the people who helped raise me was my grandfather, who was a pediatrician. He practiced medicine in this country from 1921 until the mid-1980s. And I heard details about the difference those vaccines made in saving lives in the children who were under his care. Vaccination has helped to eradicate many deadly diseases in the United States, including polio and smallpox, something we should be proud of as Americans. I am extremely concerned that as Secretary, you would be able to halt critical vaccine research and to exploit parents' natural worries by advising them not to vaccinate their children. This will lead to more children getting sick, and some will even die. Before the measles vaccine, about 500 American children died a year from measles. This is too much of a risk for our country, and there is no reason that any of us should believe that you have reversed the anti-vaccine views that you have promoted for 25 years. For example, you have previously falsely suggested that the polio vaccine killed many, 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 many more people than polio ever did by causing fatal cancers, while rigorous safety studies show that to be completely false. Now, let's go to something we agree upon. I am really heartened to see that one area where we agree on is on women's reproductive freedom. In your own words, it's not the government's place to tell people what to do with their bodies. You said that, correct? Yeah. Mr. Kennedy, in 2023, you came to New Hampshire and said, quote, I'm pro-choice. I don't think the government has any business telling people what they can or cannot do with their body. So you said that, right?
Yes.
Yep. But you also said we need to trust the women to make that choice because I don't trust government to make any choices. You said that too, right?
Yes.
It is remarkable that you have such a long record of fighting for women's reproductive freedom, and really great that my Republican colleagues are so open to voting for a pro-choice HHS secretary. So, Mr. Kennedy, I'm confused. You have clearly stated in the past that bodily autonomy is one of your core values. The question is, do you stand for that value or not? When was it that you decided to sell out the values you've had your whole life in order to be given power by President Trump?
Senator, I agree with President Trump that every abortion is a tragedy, that we can't be a moral authority in this country.
Right, so, but that isn't what you said back in New Hampshire in 2023. My question is exactly when did you decide to sell out your life's work and values to get this position?
Senator, I agree with President Trump that every abortion is a tragedy.
So what you're telling us, just to be clear, because my time is limited, is that regardless of what you believe, regardless of what values you have, if President Trump tells you to do something, you're going to do it. You said just now the discussion about mifepristone. Oh, he's asked me to study the safety of it. Here are the safety studies that tell us mifepristone is safe and effective. And I asked Mr. Chair that these about 40 studies be admitted to the record by unanimous consent.
Without objection.
So the studies are there. The safety is proved. The science is there. But what you're telling us is if President Trump orders you to take action to make it harder for women to get direly needed health care, you'll follow his order. If Mr. Trump, as he did yesterday, orders a halt on Medicaid payments that are essential for taking care of people with disabilities all around this country, you're going to follow that order because you are willing to sacrifice your values, your knowledge, if President Trump tells you to do that. That, to me, is unacceptable in a Secretary of Health and Human Services.
As I explained before, the White House has issued a statement saying that that policy will not deprive any American benefits.
The problem is the White House issued that statement only after we pointed out the damage it would do, and it became politically uncomfortable for them. You know what else that freeze on federal funding did? It halted funds for critical research that could cure pediatric cancer. So if the president tells you to do that, you're going to stop that too. That's enough.
Thank you. Senator Cortez Masto is next.
Thank you. Mr. Kennedy, thank you for coming into my office and having the conversation that we did. I appreciate your passion and your belief, and you've spent years really talking about the issues that matter to you, and I appreciate that. Let me ask you a couple of questions, though I just need some clarification. Right now, there's a 40-year-old law that requires hospital ERs accepting payment from Medicare to actually provide emergency care to patients. So let's say a woman experiencing a life-threatening condition like a heart attack goes to the ER. As a lawyer, you would agree that that federal law protects her right to emergency care, correct?
Yes.
So now a pregnant woman with life-threatening bleeding from an incomplete miscarriage goes to the ER. Let me rephrase that so you can hear. A pregnant woman with a life-threatening bleeding from an incomplete miscarriage goes to the ER, and her doctor also determines that she needs an emergency abortion. But she's in a state where abortion is banned. You would agree also as an attorney that federal law protects her right to that emergency care, correct?
I don't know. I mean, the answer to that is I don't know. If the state bans
Well, let me ask you this as an attorney. Doesn't federal law preempt state law?
The federal Constitution does. Sometimes not every federal law preempts state laws. It could be unconstitutional. Now, I'm not trying to be evasive,
let me ask you
Senator. I'm
this.
just telling you I don't know the
I
answer
appreciate
to
that.
question.
But what authority do you have over this as the director of HHS?
What authority do I have?
Yeah, to enforce the law.
In what regards?
To make sure that a hospital that receives payment from Medicare is ensuring that they're providing the necessary emergency care to patients when they present. It's actually the EMTALA law. So what authority as HHS director do you have with respect to EMTALA?
My understanding is that I have budgetary power and that it's pretty much limited to that. But if you tell me I have another authority, I don't even think that.
Well, let me tell you,
we
you
have
do.
a law enforcement branch at HHS.
Actually, you do, and that's CMS. CMS actually investigates complaints of EMTALA violations, as well as the Health and Human Services Inspector General, who, by the way, was just recently fired by Donald Trump. So you will be enforcing EMTALA laws, and it's important that you understand their impact and don't play politics with the patient presenting at the ER based on a position that this administration has taken. Let me ask you another question. When we met in my office, you said about lowering drug prices, that when Big Pharma price gouges, the American people suffer. I think we both agree on that. And I think you're sincere in your belief that you want to reduce prices for Americans, correct?
Yes.
Yeah. The Inflation Reduction Act empowered Medicare to negotiate prescription drug prices. It penalizes drug companies for price hikes above inflation, and it caps seniors' out-of-pocket drug costs, along with reducing insulin prices to $35 per month. But your future boss, Donald Trump, on his first day in office, revoked President Biden's executive order that actually directed the health secretary to examine ways to reduce drug prices and improve access to innovative therapies for the American people. And unfortunately, Republicans in Congress want to repeal the Inflation Reduction Act, which means reversing all of those things that we worked on to lower prices for Americans. So my question to you is, what do you do? Why are you there? Are you there to be a rubber stamp to this administration and cave into all of these positions that they're taking, even though you know they're in disagreement with your positions on lowering drug prices and that they could harm Americans? How do you handle that as HHS director?
Senator, my understanding is that the White House issued an executive order, I believe today, supporting the drug negotiations under the IRA. President Trump was very aggressive during his first term about negotiating drug prices. He has instructed me, and I've met with him repeatedly on as that we need lower prices than seniors in this country, and
so let me ask you. Let me ask you this, because I only have so much time. So we've already negotiated lowering prices for 10 drugs with Big Pharma, and Big Pharma, by the way, opposes this. They have not only are asking for a pause, they have filed lawsuits, but we've already negotiated the first 10 drugs. And we want to expand it to the next 10 to 15 that the Biden administration has put forward. Would you agree and continue that path of really mandating that Big Pharma come to the table and negotiate drug prices for Medicare so we can lower those prices for Americans?
My understanding is that the executive order that was issued today, which I haven't seen, but I've read a summary.
Well, let me ask you this then, because you keep citing the Trump administration and you're just going to follow what they say. Is that what you're doing? You're just a rubber stamp for them in this position? So anybody, so it doesn't matter that you're before us. It could be anybody coming before us as long as they're a rubber stamp for this administration and disregarding your beliefs and what you think. I guess my question to you is, if it really is fundamental to what you believe, how do you live with that? How do you address those issues as you're moving forward, knowing that it's going to harm Americans? Yeah.
You want me to answer the question?
No, I'm asking you.
Okay. President Trump has asked me to end the chronic disease epidemic and make America healthy again. And I'm
So
in
is
a
that the
unique
only reason
position.
why you're at HHS? Is that the
Excuse
only
me.
reason why then you're at the HHS, to address that one issue?
President Trump has asked me because I'm in a unique position to end that. And that is what I'm doing. And if we don't solve that problem, Senator, all of the other disputes we have about who's paying, and whether it's insurance companies, whether it's providers, whether it's HMOs, whether it's patients or families, all of those are moving deck chairs around on the Titanic. Our ship is sinking. Our 60% increase in Medicaid over the past 4 years is the biggest budget line now, and it's growing faster than any other. And no other nation in the world has what we have here. No other nation has a chronic disease. We have the highest chronic disease burden of any country in the world. We had, during COVID, we had 16% of the COVID deaths in a country. We only have 4.2% of the world's population. We had a higher death count than any country in the world. And when CDC was asked why, they said it's because Americans are the sickest people on earth. The average person who died from COVID, American, had 3.8 chronic diseases. This is an existential threat economically, to our military, to our health, to our sense of well-being. And it is a priority for President Trump. And that's why he asked me to run the agency. And if I'm privileged to be confirmed, that's exactly what I'll do.
Senator Barrasso.
Thanks so much, Mr. Chairman. Mr. Kennedy, thank you for taking time to visit with me in my office prior to today's hearing to talk about a lot of the important issues affecting health care in my home state of Wyoming, as well as the nation. I appreciate your willingness to serve our country. During our meeting, we discussed the challenges that health care providers and patients are facing in rural America. Financial obstacles facing rural hospitals, workforce shortages, issues of OBGYN, and then new regulations that are painful that have come out of the Biden administration, hurting our ability to provide nursing home staffing. So let me start, if I could, with rural hospitals and the closures of hospitals like that. There are a lot of challenges facing hospitals in rural communities and frontier areas. We have 33 hospitals in Wyoming. 26 are really located in various locations, often hard to get to. Weather impacts them. 6 of the hospitals are at risk of closing. 2 are at immediate risk of closing in the next 2 years. 10 have had to cut available services. And this is a concern of rural hospitals in both Republican and Democrat states, either way, bipartisan. Critical that the workforce challenges, financial challenges that we're facing are addressed. Can you commit to working with us on a plan to address the critical nationwide issue of rural health care?
Yes, yes, Senator. And I would say that during my visits, I visited almost 60 senators so far. And the most common unifying, I would say, issue among both Democrats and Republicans, there were 2. One was PBM reform, and the other is rural hospitals. And, you know, our nation made a commitment over 100 years ago to put up a hospital within 30 miles of every American. We generally succeeded in doing that. It's absolutely critical. It's life-saving. And rural hospitals are closing at an extraordinary rate right now. They not only provide important health care for the localities, but also they're economic drivers for localities all over this country. President Trump is determined to end the hemorrhage of rural hospitals, and he's asked me to do that through use of AI, through telemedicine, which these are innovations that I saw the other day. A Cleveland clinic has developed an AI nurse that you cannot distinguish from a human being, that has diagnostics as good as any doctor. And we can provide concierge care to every American in this country, even those, the remote parts of Wyoming, Montana, Alaska, et cetera. We also have opportunities at HRSA and at the GME to finally live up to GME's mission of providing personnel to rural hospitals. And I intend to use all of my power, because I've seen the priority that is given by both Democrats and Republicans on this committee. I intend to make that a priority if I'm privileged to be confirmed.
Well, I appreciate it, because often with financial strains on a local hospital, one of the common services to be cut in rural hospitals is maternity services. So now we have women in Wyoming having to drive over 100 miles to access care. 13 counties in Wyoming don't have access to OB. And we're talking counties larger than the states of Vermont, New Hampshire, Rhode Island, Connecticut, New Jersey, Delaware, counties larger than those whole states. So will you commit to working with my office to find solutions to help address these specific maternal health challenges in rural America?
Yes, Senator, I look forward to it.
Another issue we specifically spoke about with this harmful Biden administration rule that have really been bad for our rural nursing homes. And it's a rule that would triple the registered nurse requirements in nursing homes. This is going to lead, there just aren't enough registered nurses in our state to be able to comply with this. This would lead to nursing home closures across our state. Will you commit to working with me to fix this serious problem that it was a result of a rule that came out by the Biden administration, who clearly doesn't understand rural America?
Yes, Senator, I think the rule was well-intentioned, but as you've said, and I've heard from many rural senators, it will be a disaster for their states. Some of the nursing homes, these are staffing rules that require 24-hour staffing by medical professionals. Some of the nursing homes in rural areas simply do not have the available personnel or the economics to be able to do that. It will mean the closure of nursing homes in rural areas across our country, which means the parents, the elderly parent, will be moved a great distance from the local community and their family. And we know that the single greatest driver of high-quality nursing home care is the involvement, the proximity of family members. When you move that nursing facility away from the community where the kids live, you're going to get much worse care. So the intention, although it was noble, was in reality, for rural areas at least, it is going to be a disaster.
Thank you. Thank you, Mr. Chairman.
Thank you. Senator Johnson.
Mr. Kennedy, welcome. Thank you for being here. Thank you for your decades-long advocacy for a clean environment, for children's health. I can't say as I'm surprised by the hostility on the other side. I'm highly disappointed in it. I don't know if you remember when you called me up and you were contemplating setting your political differences aside, joining forces with President Trump on an area of agreement, addressing chronic illness, trying to find the root cause of all these problems facing this nation. My first response was, Bobby, this is an answer to my prayers. We need to get to the answers of this, but even more, we need to heal and unify this divided nation. I'm not necessarily the most optimistic guy because we've got enormous challenges facing this nation, but I thought, wow, here's somebody from the left, somebody I don't agree with on many issues politically, coming together with President Trump and focusing on an area of agreement, something that the American people desperately want. Finding out the answers. What has caused autism? What is causing chronic illness? Mr. Kennedy, I think I've come to know what's in your heart. I think I know the personal and political price you've paid for this decision. I want to say publicly, I thank you for that. I truly appreciate what you're doing here. Can't we come together as a nation and do this? Can we do? Aren't you getting tired of this? I'm getting tired of this. So again, Mr. Kennedy, I need to enter in the record. These are just 11 letters of support signed by 63,000 people, thousands of doctors, from the American Association of American Physicians and Surgeons, Independent Medical Alliance, the North Carolina Physicians and Freedom Group, Governor Jeff Landry from Louisiana. These are Americans, nonpartisan. A lot of these people, I know because I've advocated with you. A lot of them are Democrats. They put their political differences aside. So, Mr. Chairman, I'd like to enter this in the record.
Without objection.
I also do want to, Mr. Kennedy, as long as I have you here, I've written over 70 oversight letters to the federal health agencies under the Biden administration. I've virtually gotten squat out of them, okay? What I get is we get, for example, 50 pages of Anthony Fauci's emails redacted. Oh, by the way, the latest one was 17 pages. Instead of issuing a health alert on the myocarditis they knew was impacting young men early in 2021, instead of issuing an alert on the Health Alert Network, they developed 17 pages of talking points. This was given to the public under a FOIA request. They had to go to court. They've got a new way of redacting. They don't black things out. They just give you white pages, so you don't even know what they have redacted. So again, I've issued a subpoena now to cover the information I've requested in 70 oversight letters. My question to you is, as Secretary of HHS, will you honor these requests from Congress, and will you make HHS transparent?
Yeah, my approach to HHS, as I said before, Senator, is radical transparency. Democrats and Republicans ought to be able to come in and get information that was generated at taxpayer expense, that is owned by the American taxpayer. They shouldn't get redacted documents. Public health agencies should be transparent. And if we want Americans to restore trust in the public health agencies, we need transparency. I want to say something about what you first said. When I launched my campaign, it was about uniting Americans, Democrats and Republicans. There's no issue that should unite us more than this chronic health epidemic. There's no such thing as Republican children or Democratic children. These are our kids. 66% of them are damaged. I know what a healthy kid looks like because I had so many of them in my family. I didn't know anybody with a food allergy growing up, peanut allergy. Why do 5 of my kids have allergies? Why are we seeing these explosions in diabetes, rheumatoid arthritis, neurological diseases, depression, all of these things that are related to toxics in the environment? Why can't we just agree with each other to put differences about so many issues, intractable issues aside, and say, we're going to end this? I don't think anybody is going to be able to do this like I have because of my peculiar experience, because I've litigated against these agencies. When you litigate against them, you get a PhD in corporate capture and how to unravel it. I've written 6 books about these agencies. I know a lot about them and I know how to fix it. And there's nobody who will fix it the way that I do because I'm not scared of vested interests. I don't care. I'm not here because I want a position or a job. I have a very good life and a happy family. This is something I don't need. I want to do this because we're going to fix it. And the other thing is we are attracting now a caliber of people to HHS like never before in history. And they're entrepreneurs, they're They're disruptors, they're innovators of immense talent that are walking away, many of them from growing concerns. They're not coming there for position. They're coming there because they want to save our country. And they're from across the political spectrum. And all these Democrats are opposed to me for partisan issues. They used to be my friends. Agreed with me on all the environmental issues that I've been working on for my whole career. Now they're against me because anything that President Trump does, any decision he makes, has to be lampooned, derided, discredited, marginalized, vilified.
We need to move on. Senator Warren.
Thank you, Mr. Chairman. So, Mr. Kennedy, I want to start with something that I think you and I agree on, and that is that Big Pharma has too much power in Washington. You've said that President Trump asked you to, quote, clean up corruption and conflicts. Sounds great. You've said that you will, quote, slam shut the revolving door between government agencies and the companies they regulate. That also sounds great. So here's an easy question. Will you commit that when you leave this job, you will not accept compensation from a drug company, a medical device company, a hospital system, or a health insurer for at least 4 years, including as a lobbyist or a board member?
Can you just repeat the last part of the question? Can I commit
You're
to
not
what?
going to take money from drug companies in any way, shape, or form.
Who? Me?
Yes, you.
Oh. Yeah, I'm happy to commit to that.
Okay, good. That's what I figured. I said it's an easy question to start with. And I think you're right on this
I don't
question.
think any of them want to give me money, by the way.
Let's keep going. You're right because to say yes, because every American has the right to know that every decision you make as our #1 health officer is to help them and not to make money for yourself in the future. So I want to talk more about money. I'm looking at your paperwork right now. In the past 2 years, you've raked in $2.5 million from a law firm called Wisner Baum. You go online, you do commercials to encourage people to sign up with Wisner Baum to join lawsuits against vaccine makers. And for everyone who signs up, you personally get paid. And if they win their case, you get 10% of what they win. So if you bring in somebody who gets $10 million, you walk away with $1 million. Now, you just said that you want the American people to know you can't be bought. Your decisions won't depend on how much money you could make in the future. You won't go to work for a drug company after you leave HHS. But you and I both know there's another way to make money. So, Mr. Kennedy, will you also agree that you won't take any compensation from any lawsuits against drug companies while you are secretary and for 4 years afterwards?
Well, I'll certainly commit to that while I'm secretary. But I do want to clarify something because you're making me sound like a shill. I put together that case. I did the Science Day presentation to the judge on that case to get it into court without a hearing.
Mr. Kennedy, it's just a really simple question.
Yeah,
You've taken in $2.5 million. I want to know if you will commit right now that not only will you not go to work for drug companies, you won't go to work suing the drug companies and taking your rake out of that while you're a secretary and for 4 years after. It's just...
I'll commit to not taking any fees from drug companies while I'm secretary.
No. I'm asking about fees from suing drug companies. Will you agree not to do that?
You're asking me to not sue drug companies,
no,
and I'm not going to agree to that,
drug
Senator.
Companies as much as you want.
I'm not going to agree to not sue drug companies or anybody.
So let's do a quick count here of how, as Secretary of HHS, if you get confirmed, you could influence every one of those lawsuits. Well, let me start the list. You could publish your anti-vaccine conspiracies, but this time on U.S. government letterhead, something a jury might be impressed by. You could appoint people to the CDC vaccine panel. who share your anti-vax views and let them do your dirty work. You could tell the CDC vaccine panel to remove a particular vaccine from the vaccine schedule. You could remove vaccines from special compensation programs, which would open up manufacturers to mass torts. You could make more injuries eligible for compensation even if there is no causal evidence. You could change vaccine court processes to make it easier to bring junk lawsuits. You could turn over FDA data to your friends at the law firm, and they could use it however it benefited them. You could change vaccine labeling. You could change vaccine information rules. You could change which claims are compensated in the vaccine injury compensation program. There's a lot of ways that you can influence those future lawsuits and pending lawsuits while you are Secretary of HHS, and I'm asking you to commit right now that you will not take a financial stake in every one of those lawsuits so that what you do as Secretary will also benefit you financially down the line.
I'll comply with all the ethical guidelines.
That's not the question. You and I, you have said
You're asking me, Senator, you're asking me not to sue vaccine pharmaceutical companies. Yeah, you are. That's exactly what you're doing.
Look, no one should be fooled here. As Secretary of HHS, Robert Kennedy will have the power to undercut vaccines and vaccine manufacturing across our country. And for all of his talk about follow the science and his promise that he won't interfere with those of us who want to vaccinate his kids, the bottom line is the same. Kennedy can kill off access to vaccines and make millions of dollars while he does it. Kids might die, but Robert Kennedy can keep cashing in.
Senator, I support vaccines. I support the childhood schedule. I will do that. The only thing I want is good science, and that's it.
How about then say you won't make money off what you do as Secretary of HHS?
Before we go to Senator Tillis, I think it would be important for me to make it very clear that Mr. Kennedy has gone through the same Office of Government Ethics process as every single other nominee in the Finance Committee this year and in previous administrations. In addition to listing his assets, including the items that you've identified, he has signed an ethics letter that has been reviewed by the Office of Government Ethics concerning any possible conflict in light of its functions and the nominee's proposed duties. And we have a letter from the Office of Government Ethics that he hasn't complied completely with all applicable laws and regulations governing conflicts of interest.
Mr. Chairman, point of information here. Have we had a single nominee come through who's made $2.5 million off suing one of the entities that it would be regulating and plans to keep getting a take of every lawsuit in the future? Have we had that before?
I haven't reviewed the past documentation of every other nominee's financial interests, and so no. But I know that every single time we get a nominee, their financial interests are attacked. That's why we have the Office of Government Ethics. That's why they've reviewed everything that's in his record, and that's why he has even, I think, and I don't know that I want to ask him to get into it, but he has listed his assets and has gone through a discussion of the responsibilities under our ethics laws and is complied with all of those requirements. Senator Tillis.
Thank you, Mr. Chairman. Mr. Kennedy, how's your morning going?
So far, so good.
Good. You came prepared. I'm glad that you did.
Guys, we're gonna have to split this up into two parts. I'm like about to pass out. 2 hours in, 2 hours 4 minutes, and we'll come back in when this gentleman, Senator
I believe, addressed my
Gonzalez, is the one that's going to be speaking. I appreciate you guys very much. Thank you for your participation and being involved in here. So about 17K came through. Not too bad. Yeah, on the way out, like, subscribe, give it some hearts or some of those other icons on the YouTube. I'd appreciate it very much. And you guys take care. Speak soon.
Darkness falls, truth emerges, political cow unveils the lies. behind the screen, wisdom surges, lighting up hate with her eyes. In the shadows, secrets lurk. She exposes, she ignites. With every post, she does the work, unmasking darkness, revealing lights.